getting more sophistication with these community cat programs and what is needed. And everyone's struggling with money. Veterinary staff are short in supply. And so, what is going to make the most effective use of funds? And just to give you a bit of a recap, that this program is in the city of Ipswich, which is adjacent to Brisbane, and Brisbane has, a coastal front. We started in this small country town. That was our pilot, which is Rosewood, 3,000 population. And then we moved to two inner suburban areas of Ipswich. They're all low socioeconomic. They've all got CFIA indexes below the average. Their unemployment rates are 2 to 3 times the average for Australia. For example, in Rosewood, the individual weekly income in the last census was $636. So it gives you an idea of the sort of people that we're working with. This is the most recent data, and this is after we've expanded the program a bit. But we've got a steady decrease in intake in the target suburbs, and euthanasia as well. So that's really encouraging. And I'll show you a little bit of data from Rosewood, but we're planning to publish that fairly soon. So this gives you a summary of what we've been seeing. So most of the cats are actually owned cats. And in these low socioeconomic suburbs where people passively acquire their cats, they don't have the funding. And, their priorities is food on the table, a roof over their head, being able to turn the lights on and getting to work if they've got a job, or getting the kids to school. And so getting a cat desexed is, it's not the highest priority, and it's not even responsible for them as a whole unit and looking at their welfare to spend $300 to $500 on getting the cat desexed. Because the consequences of it having kittens is far less than the consequences of not being able to put food on the table or being evicted. Because, the kittens are born, they take them to the shelter, or the kittens wander off and find someone to look after them, and some of them die. Anyway, so 80% of the people whose cats we've desexed, and we've desexed now nearly 3,000 cats, 11% of those that we've desexed didn't consider themselves owners when the cat came into their life, but at the time of the cat being sterilised, they were happy to be the owner, even though they still, when they enrolled in the survey, said they were not the owner, but they were taking ownership. And so it was nearly everyone who was caring for 1 or 2 cats was happy to take ownership of it. Some of what was called restricted matter cats, kittens were rehomed. That's only a small percent. But this group is really important. So that's what we've got the only permit for in Australia, essentially a TNR permit and a return to field permit. And if you don't know about return to field, it's where a poorly socialised cat comes in, is impounded, and it would have to be euthanized. We can desex it and put it back to where it was found if it's in good condition, assuming that it's actually an owned cat or someone else is feeding it, and that's what it's turning out to be. And most of those restricted matter cats, and we've done 220 now, those cats are mostly continuing just to be cared for. They've remained semi-owned. So, we know who the carer is, and they're being cared for. A very few are returned to field, and we've done, maybe 12, 15 of those in the Rosewood pilot that we're publishing. It was only 2. And it's not a lot, but that is absolutely life-saving, not only for the cat, but for the people caring for it. Because now that shelters are putting more and more effort into reducing euthanasia rates, it means that these cats they'll work with maybe for 2, 3 or more weeks, and then the cat is likely have to develop some trust with the people who are helping to socialise it, but it's still not really adoptable. It hisses, it hides, swats when someone comes down to look at it to adopt it. And so a decision is made that it's not going to be adoptable in a reasonable time and it needs to be euthanized. And you can imagine if you've just worked with that cat and you've developed trust with it, to be then come into work the next day and find the cage is empty because it's been euthanized, or you're asked to take it down to the euthanasia room, that impact on your mental health and feeling you failed the cat is just huge. And we have to be recognizing that this return to field is really important. And now in the US, about 12% of stray cats coming into shelters are returned to field. For that. And I can tell you some stories about some of those cats, because they've all the restricted matter cats have got my personal mobile phone number on the database as the secondary contact. And yeah, if you're interested later on, I can tell you about some of those that I've been contacted for. So this is the Rosewood pilot. Rosewood's a country town, 3,000 people. Like country towns, are connected. The distance was short. We were very grateful of the pet stock donation, which allowed us to get the initial cats desexed through initial 95 through Rosewood Veterinary Services, which was in town. And you can see that pretty quickly we had a good decrease in intake, and also euthanasia really decreased dramatically. We're now about to publish the 3-year one, and the average of the last 2 years is, I think, 85% decrease in euthanasia. So it works. But then we moved on to Red Bank Plains, and it's low socioeconomic also, but it's different. But your education levels are again below the Australian average, the same as Rosewood. And we're aiming for 30 cats per 1,000 residents to be desexed, because that's what, based on the limited information in the literature, was the minimum needed to be desexed per year. And a lot of the desexing spots were going begging, and we were really frustrated that we just couldn't get people signing up. And in most cases, they needed to be able to transport their cats. We did offer free transporting, but it wasn't working. So you can see, after desexing 418 cats, and this is the population, we didn't get any decrease. So then we decided that we needed to micro-target, and what we did was we plotted on a map where those cats were coming from. And the circles are stray cats, and the darker the red, the more cats that were coming in. The blues are owner-surrendered cats. So you can see they're mainly stray cats. So we went and door knocked there, dropped flyers. But it is a little bit, closing the door after the horses bolted, because these were where the cats were coming in from. But at least it was a start, and we found, generally where 3 cats have come in from, there's more cats there. And so after we did that micro-targeting, we finally got a decrease in Red Bank Plains, which was very rewarding. And it became clear that, some people don't even have internet, some people don't even have a phone, they're not engaged with the community, they're struggling in their own life. They may not hear about the program very often, or may not think that it applies to them. So micro-targeting is the key. And what's come out of that, and that's why I'm so concerned about the Victorian funding if it's not used correctly. So the key factors are intensity, and it's the total number of cats that need to be desexed each year to get a measurable outcome. And it depends whether you don't target it. So non-target is if you decide to use, just allow anyone across the city to get subsidised or free desexing for their cats, and target is for suburbs. And the classic failure of this at the city level was South Australian RSPCA, where they had $200,000 of donor funds and $50,000 from the council, and they targeted, and Onkaparinga was 180,000 people, and they were only able to desex, they only had the capacity to desex 700 cats. And that was only enough for a population, depending on how they did it, of between 20 to 30,000 people. But they tried to spread it over a population of 180,000 with no micro-targeting. And I spoke to the mayor that was there at the time. She's now a member of parliament for South Australia, and she said, oh, it doesn't work. And that's the last thing that you want to have happen, for people to say it doesn't work. And that's why I'm frightened that the Victorian model, they'll say, oh, it doesn't work. Because whether it's target or non-target depends on the human population and how much money you've got, and your budget and your veterinary capacity. So, but if you highlight risk of either surrendering their cat or having it impounded, then you don't have to desex nearly as many. And Jenny Cottrell's example, hers was about 4 to 5 cats per 1,000 residents. And there's the paper from, that's a Spihar and Wolf paper now from 6 cities in USA. And that micro-targeting, they were able to get a drop, a measurable drop in intake, and it was to those, red flag areas. So intensity is key, and obviously targeting. So this, for example, if it's untargeted, if we went for the whole city of Ipswich, which is a population of, at least 230,000 people now, we would have to desex between 30 and 60 cats per 1,000 residents, which is 7 to 14,000 cats a year. And we just don't have the resources to do that. There's not the desexing capacity, there's not the money. We could just target it, which is what we've been doing mainly, to 3 suburbs, and then we'd only have to desex between 1,000 and 2,000 cats. But if we micro-target it, we can do the whole of the city of Ipswich for about 2,300 cats a year. And obviously, if you don't have much budget, just keep it micro-targeted to those suburbs, if you don't have the resources to micro-target. And the issue is that micro-targeting, the key thing to making it successful is community engagement. And AMO support is critical for it being effective. And unfortunately, in Ipswich, they initially said that AMO, they weren't going to provide any funding or in-kind support, and AMOs continued to just trap cats independently and bring them in. That's still happening, but increasingly they're letting AWL know in advance and engaging them. But it's only some animal management officers. And clearly there's a need for a training program, and I've asked Jenny Cottrell to put some ideas together for that. Anyway, and then duration, obviously. The higher intensity, the less time to get measurable effects, but you have to continue. You can't just go in there and move out. You have to continue at a low level once the outcomes are achieved. So, and, I found this data that the median tenancy in Queensland is 17.5 months. So every, sort of people move on average, a year and a half in a rental property. And people who own the house, there's a 6% per year turnover. So there's significant turnover every year with people coming in, either acquiring kittens for free or bringing undesexed cats in. And you can never get every cat, so there will be still some kittens being born. And just to really emphasise this was Julie Levy's classic paper where they sterilised 60 cats per 1,000 residents for 2 years. And it was in a population of 20,000 people. That was their target area. And you can see at that high level, they got a very rapid drop. This is desexing, and the dotted line, this is intake and euthanasia, and very rapidly. Within 2 years, they got a marked drop. Here, they were still desexing at 8 cats per 1,000 residents, and it was untargeted spay, neuter, TNR through that. And you can see that it really, by going high intensity, they were able in a short time frame to reduce intake by 66%. So intake was 3.5 times higher in this control area, and euthanasia was 17.5 times higher. But that's a lot of resources to desect 60 cats per 1,000 residents, and this is what happens when it's not targeted. I'm not sure whether there's any questions about that. I've just got a very few more slides to go on to. Were there any questions about that targeting, micro-targeting, or will we save it till after?
I just quickly had one. That graph that you just showed before, I see, yeah, that one, and from 2014. Have you got any graphics like that for the work you've been doing?
We can do one. We haven't put that together, but we've got bar graphs, like I showed you, that we're about to publish.
Okay, cool. Yeah, because I think that really explains it well at a kind of base level for anybody who's not quite understanding or has a very basic understanding of a community cat program. I think that really shows the impact.
Yeah, so we don't have this sort of the non-target area where a little bit of desexing's been done. Well, we probably do, but drilling, it takes a lot of time to drill down with all that data and get that out, and that's been a big factor in slowing down things, because we've initially we were paying someone, but it was costing us $20,000 each time we wanted to analyze the data, and we're doing that every 6 months, and we couldn't afford to do that, so we got a volunteer, and that comes with its own challenges.
No, all good.
So this is a really interesting question we asked. This was a compulsory question. No, it wasn't. This was not. This was a voluntary question in a compulsory. They had a question about cats' health and things like that before they were being desexed, and then there were some optional questions at the end, and this was one of them. If at first you didn't consider yourself to be the owner, but what made you change your mind? But you do now. What made you change your mind? And there was 3 themes that came up. And it was being responsible, wanting to do the right thing. The second theme was becoming more attached to the cat. And this was again wanting to do the right thing, doing the right thing, stopping kittens being born. And the third theme was hearing about the opportunity to get it desexed. So, these people do want to do the right thing. They do want to be responsible. They do want to stop kittens being born. But when you're living on, $636 a week, how the hell do you do that? When cats come in, you feel sorry for it. You can afford to, but you can just afford to feed it, but not much more. So that's really, I think. And when we asked them which 5, just choose one, it was the same themes: wanting to be responsible, more attached to it over time, and desexing. The third theme was sort of protection. The cat was in danger of being hurt, and the cat was at risk of being trapped by an animal control officer. So these are just sort of summary slides that a community cat program's more than just a desexing program. It's about community assistance to prevent surrender and impoundment. And, it comes from that philosophy that shelters are not the best place for the majority of cats. They're stressful for most cats, and there's a high risk of them getting cat flu. I know some of the data, at least 30%, develop signs of cat flu in some of the big shelters, and it can be higher at times. And now, there's been outbreaks at both AWL and RSPCA up here of panleukopenia, and I think in other shelters too. And I really like this idea of the cat superhighway that the University of Florida developed. And, it's this idea that there's a right outcome for every cat. And it was developed for community cats, but it's equally applicable to all cats. And it's this idea that there is a right pathway for every cat. only cats that will benefit more from coming into a shelter than other outcomes should come into a shelter. And that may be because it's sick and the shelter has vets that can treat it. And it's beyond the capacity of the person caring for it. But there's better outcomes for many cats, and that includes home-to-home adoption after we've got them sterilised, or directly to a foster carer. And, this idea that foster carers should be able to adopt the cat to a new owner without it coming back to the shelter. And, your home-to-home program is really important. And it's about supporting people. Do they need food? Do they need cat litter? Do they need help with fencing? Those sorts of things are all part of this, getting a right pathway for the cat and giving people assistance to keep their cat with good cat caring, so the cat's welfare is, it's a good environment for the cat. And I love this, I'll probably show this at most of my presentations. I love this quote by Maya Angelou: do the best you can until you know better. Then when you do better, do better. So that's all I've got to share with slides.